Okay, let's start with our section first of lecture diseases of nasal septum, and in this we will talk about the anatomy and then fractures of the nasal septum. Our first section, anatomy and fractures of the nasal septum. In this section we will talk mainly about the Kiesselbach's plexus. Then we will talk about etiopathogenesis or how it occurs, what are the different types of fractures of the nasal septum and how they can occur, and then what are the treatment options available and what are the complications of the nasal septum fracture. So first, the anatomy. Anatomy is the study of the basic structure of the organ or part. So study of the structure. So when we talk about the structure of the nasal septum, that's the structure of the nasal septum, how it appears. You see, this is the nasal spine of frontal bone. All these bones and all these structures participate in the formation of the nasal septum or give the structure to the nose. So we have the nasal spine of the frontal bone. So if you see here, this is the nasal spine of the frontal bone contribute to the formation of the nasal structure. This is the nasal spine of frontal bone. Then we have the crest of the nasal bone. This is the crest of the nasal bone. Then there is septum, membranous septum and columellar septum. Anterior nasal spine of the maxillary bone. This is the maxillary bones. It participate or it contribute to the shape of the nose. So we have the nasal spine of the maxilla. Then the crest of the maxilla. We have crest of maxilla. Also there is crest of palatine bone. These are the septal cartilage, then the perpendicular plate of ethmoid bone, and then we have the vomer bone, and then the rostrum of sphenoid bone. So all these are the structures that contribute to the formation of the nasal structure or formation of the bone. Nasal, all these bones. So mainly we have the vomer part of the ethmoid bone, perpendicular plate of ethmoid bone. Then we have septal cartilage, columellar septum, membranous septum, and the crest or the spine of the frontal bone and the crest of nasal bone. So all these are the bones that are participating in the formation of the nasal framework or framework of the nose. When we see this columellar septum here, this columellar septum, if you see in the diagram, this is the foremost part of the nasal structure, columella or columellar septum. This is formed of columella containing the medial crura of alar cartilages united together by fibrous tissue and covered on either side by the skin. So this columellar septum is composed of the medial crura of alar cartilages. So just this portion you can see is the columellar portion covered on both sides by the skin, and they are united together from both sides of the structure by the fibrous tissue. So just in front we have the columellar septum. Then the other structure you can see, we have the membranous septum. This is the membranous septum behind the columellar septum. This membranous septum consists of double layer of skin with no bony or cartilaginous support. between the columella and the caudal border of septal cartilage. Here if you see, this is the septal cartilage, this is the caudal portion of septal cartilage, and this membranous septum is between the columellar septum and the septal cartilage. This is the membranous septum. It's covered by the skin, consists of double layer of skin without any bony or cartilaginous support. Both the columellar and membranous parts are freely movable from side to side. So roughly if we see this nasal portion here, freely movable from side to side, consists of the columella, and behind that we have membranous septum. Membranous septum is between the columellar septum and the caudal portion of our septal cartilage here. This is the membranous septum, freely movable from side to side, both the columellar and the membranous septum. They have no cartilaginous support, no bony support. That's why it's very freely movable structure, and we can easily move this part of our nose here. Next, this portion in the center, which is composed of perpendicular plate of ethmoid bone. Then we have the vomer bone here. This is the vomer, and then the septal cartilage. This is known as the osteocartilaginous framework. This is the osteocartilaginous framework. Osteo is for the bone. Cartilaginous is for the cartilage that's little harder than the bone. So it's the nasal septum is more cartilaginous structure, and the upper part of the nose has the bone structure. So osteocartilaginous framework, it is composed of mainly three parts. We have septal cartilage, and then we have the plate of ethmoid, perpendicular plate, and the vomer bone. This is, and all this portion, our osteocartilaginous framework consists of ethmoid, vomer, and septal cartilage. Perpendicular plate of ethmoid, vomer, and septal cartilage. This septal cartilage, it is edged between the above two bones anteriorly. So it's between ethmoid and the vomer bone anteriorly. It forms a partition between right and left nasal cavities, provides support to the tip and dorsum of cartilaginous part of the nose. So now septal cartilage, this septal cartilage, it forms a partition. It actually divides the nose into two right and left nostrils, and it provides the support to the tip and dorsum of cartilaginous part of the nose. So these are all the structures, anatomical structures of the nose, and then mainly we are talking about our nasal septum. So nasal septum has in front the columella septum, then behind we have the membranous septum, and then the septal cartilage starts from behind that divides the nose into right and left half. Three parts together make up the osteocartilaginous framework of the nose, that is composed of septal cartilage, perpendicular plate of ethmoid, and vomer. So all these are the different anatomical structures of the nasal septum. Next is Kiesselbach's plexus. Plexus is a network of blood vessels where they come together and combine together. So in this diagram, if you see, this is the Kiesselbach's plexus. Here it is formed by the four arteries mainly. This is the superior labial artery, which arises from facial artery, superior labial artery. Then the another artery that's participate in the formation of the plexus, this is the greater palatine artery here. And then there is sphenopalatine artery and anterior ethmoidal artery. So these are the four main arteries where they come together and form a plexus. This plexus is known as the Kiesselbach's plexus here. So superior labial artery, greater palatine artery, sphenopalatine artery, and anterior ethmoidal artery. There is also posterior ethmoidal artery, but it doesn't contribute too much to the formation of the plexus. So these are the four main arteries that give rise to the plexus. Then etiopathogenesis of fracture, how these fractures can occur. If you see again, this is the nasal septum in the center, nasal septum, and behind the septum we have the nasal bones. So nasal bones and then nasal septums here, little softer area, we can move it a little to some extent. And then this is the where we have on the side we have the cartilages, the upper lateral cartilage and lower lateral cartilage, upper lateral cartilage and lower lateral cartilage. Then the fractures are mainly due to trauma to the nose. Nose is very in front, so any trauma, any blow to the face can lead to the injury to the nose and cause fracture. So trauma on nose can cause fracture. And then septal injuries can lead to epistaxis and bleeding from the nose. Epistaxis or bleeding noses are common. As we saw in the previous slide, there is formation of the plexus very close and it can be very, very vascular. All those four vessels come and form the plexus. So epistaxis or injury to the nose can lead to bleeding from the nose. The fractures of the nose can be, usually they buckle on itself, and fracture can occur in different directions, can be horizontal or vertical. So vertical fractures, horizontal fracture, and then it may be there is crushing into small pieces also. So all these three scenarios can occur with the fracture of the nose. Fracture of the septal cartilage or its dislocation from the vomerine groove can lead to the injury to the lateral cartilages. So we can have fractures that can be horizontal, lateral, or the bone can be broken down into small pieces, or if there is injury to the nasal cartilages, lateral upper and lower cartilages, usually from the dislocation from the vomerine groove usually occur. So fracture of the septal cartilage can occur, or with the injury it can get dislocated from the attachment from the vomerine groove. Types of fracture of nasal septum. Two main types of fractures, as depending on the type of injury or nature of the blow, from which direction the blow occurs to the nose. So we have two fractures. Jarjave fracture. This is when the blow from the front. So from when somebody hit from the front and there is injury to the nose, usually this Jarjave fracture starts just above anterior nasal spine and runs horizontally. So Jarjave fracture is, it runs horizontally, not vertically. This is horizontal, just above the nasal spine here, and it goes horizontally backwards, just above junction of septal cartilage with the vomer. So that's how it runs, Jarjave fracture, mainly from below to the nose from the front, and it runs horizontally above the nasal spine, runs horizontally backward above the junction of septal cartilage with vomer. Next fracture is the Chevalier fracture, in which the blow is from below. One is from front, one is from below, and this can cause vertical fracture here. If you see, this leads to the vertical fracture, runs vertically from anterior nasal spine upward to the junction of bony and cartilaginous dorsum of the bone. So here, where there is junction of the bony and cartilaginous part, it runs vertically upward in that direction. So one fracture, when the blow is from the front, it's horizontal. Then the other fracture, when the blow is from below, it is vertical fracture. Both starts from above the nasal spine, and it goes in different direction. One is horizontally, one is vertically. Treatment is, this is the nasal septum. If we have as a result of, this is showing if there is different, as a result of fracture, if there is hematoma formations or any collection of blood, how it can be treated. So treatment is, hematomas should be drained that occur as a result of fracture or injury. Dislocated or fractured septal segments, they are repositioned and then supported between mucoperichondrial flaps with mattress suture and nasal packing. So first, as a result of blow, usually there is, with the fracture, we have collection of blood or hematoma as a result of bleeding. These hematomas should be removed, and then after the removal of hematoma, any dislocation or fractures, they are repositioned, and then they are sutured with the mattress suture, and then packing. This is the packing done, nasal packing, to give the support, and then to remove, to drain any secretions or blood later on. So to give the support, we do the nasal packing, and it is repaired by the mattress suture. Here, if you see, this is the hematoma, and then there is perichondrium. So dislocated or fractured portion should be repositioned between the perichondrium, mucoperichondrium, with mattress suture and nasal packing. So this is the removal of the hematoma, and then there is repositioning and packing of the nose to give the support. The complications we have in this diagram, if you see, this is the upper lateral cartilage, lower lateral cartilage, and this is the bony portion, and there is the fracture in the nasal bone here. Complications, there is deviation of cartilaginous nose, asymmetry of nasal tip, columella or the nostril. So with any fracture or injury, very common to the nose, there is dislocations occur or asymmetry occur, deviation of the nose or septum occur. So that becomes really very prominent, because if there is injury to the nasal bone, or if there is injury to the nasal septum, and when that is repaired or portions removed, naturally this gives deformity or asymmetry to the shape of the nose, which can be from the nasal tip to the columella region or nostril. So this is the main complication that occurs after the fracture or injury to the nasal area. So that was all about the section 1 of diseases of nasal septum, in which we talked about the anatomy of the nasal septum and what are the different bones that contribute to the formation of the nasal framework. And then we talked about the fractures of the nasal septum, how they can be treated, and what are the complications of the fractures that can occur. So thank you for watching sqadia.com.